Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster with my guest, Mark Clermont, CEO of Cecelia Health. Mark, thanks for joining me today.
Yeah, thanks for having me, Logan.
So we've talked at other times about how you are scaling the human touch. And I know you began with more of a focus around type 2 diabetes or diabetes, and now you're really helping folks with chronic diseases. So just start with the pitch. Just tell me what Cecelia has built.
Well, we talk about it now, just modernizing specialty care, and what that means is improving access. We've always been about improving access for patients, care navigation, that kind of thing. But where we are today is really this amazing place where technology has emerged, data has emerged, just the data availability has emerged. We understand patients so much better than we ever did before. And you look at some of the trending around primary care and access. Primary care just can't serve all the needs of patients. Particularly what then falls off is specialty care. The needs that someone with chronic disease, whether it's diabetes, whether it's CKD, chronic kidney disease, whether it's some respiratory condition, you name it, there's just so much to be done that primary care is having a real challenge. And so
talk to me about that inflection point. You said now we can combine data in new ways. You're getting new streams of data. You're understanding the patient and the chronic disease trajectory in new ways. What do you mean by that?
So there's been some regulatory shifting brought about by the Cures Act that enables data exchange, more fluid data exchange among healthcare practices. We're a healthcare practice, we're telemedicine, we practice in 50 states, a specialty medical practice. We combine and use our clinicians also in service of, if you think of that as sort of the epicenter, the core of the solar system, so to speak. We then deploy our team in kind of out in the outer rings of health coaching, of lifestyle management, that kind of thing. So if you're a patient, you're generating data. I think last time we spoke, we talked about the scotoma that there is, where patients may receive care, not medical grade care, but care from, let's say, a pharmaceutical company's patient support program. Mm-hmm. We are really good at helping patients with that, and what we see is the data that comes from that. You take some of that plus the regulation-enabled data streams that afford EHRs to talk to each other, so to speak. There's just a lot of really good insights that now I can understand Mark Clermont's clinical history much more expediently, and then that helps inform a much more personalized experience for the patient.
Describe that more personalized experience. I don't care about where the data came from, I don't care about interoperability, I just care about my chronic disease. How is my care different because of these changes?
Well, first it starts with you're no longer sitting in front of a clinician, whether it's virtual or in person. You're no longer sitting in front of, or they're in your home for that matter. You think of omnipresent care, which is really where we're all shifting to. But when that first encounter, you have the age-old one of, well, tell me about your medical history in 5 words or less. And, I'm an old guy. I've got a lot of medical history. So.
And you're thinking, I've written this down so many times. And I've been to the doctor where I said, I just typed that up for you an hour ago.
That's right.
It's still not coming into the conversation.
Yeah, so fast forward to this, so today, a lot of that information can already be ingested, with your permission, of course, ahead of time, so that we understand what your clinical profile is. Then it's just a validation. So now you're saying that experience is improved from day one as, look, we understand you, Logan. You don't need to now go tell us, the 5 things that you think are most relevant for us in your clinical history. We have it. We're just validating. Is this really you, and did these particular things? And here's what really stands out related to your disease. We see that you, let's say, have type 2 diabetes. Let's take some current biometrics. Let's understand how you have changed since your last visit. And by the way, we already have your labs from your last visit. So it's a much more enriching thing. We can talk about you. And managing chronic disease is a lifetime thing. And it's the management part, the self-management part, the education, the ongoing living and breathing with these conditions at any age. Doesn't matter what age you are, what do you do? And so we can spend much more quality time with you that way.
I know that Cecelia Health has had a strong positive reaction from the market. It's been a good year for you all, and I'm curious what it is about your approach that you think stands out.
Well, first, we were just talking about some data earlier today. So back in 2018, there were 864 million patient visits. 49% of them were referred to specialists. Fast forward today, we've seen a 19% increase in specialist visits, but only a 2% increase in population. So why is that?
Why
right?
is that? Yeah.
And so you say, well, referral from primary care is exploding. And it's happening for a number of reasons. One, people are getting older, so their chronic diseases tend to progress as we all age. But on top of that, we're asking primary care to do more and more. We're asking them to document more. We're asking them to capture more and more things in assessments. Availability, access for primary care is increasing and improving. And so you take some of the new providers out there, you can go see them right away, tomorrow, the next day, that kind of thing. And it's phenomenal for the patient. One of the great outcomes of that is we're seeing more referrals to specialists. And so that's why we talk about Cecelia Health and modernizing specialty care.
Yeah.
It's just modernizing it to make sure that we have a more bidirectional fluid relationship with primary care, serving as their extension. And that in turn creates a more empowerment for the patient.
Interesting. One of the themes of these interviews is how many products flow back into physician burnout and just the life of the physician. And I'm hearing you talk about primary care, and I'm thinking that sounds like a more fulfilling way to practice, to have a specialty care partner. So how do you feel like your work impacts just your average primary care physician?
Well, one is a primary care practitioner will have confidence that they're getting a clinically validated treatment from a specialist who also knows how to treat and work with longitudinally their patients. Two, you're getting bidirectional data. So we are returning our care plan information back to you. So your care plan that you're already tracking for your patient is now informed by ours. And what we ask of you is to create this fluid relationship. And by doing so, again, we always talk about giving the patient the power, putting them in the center.
Yeah.
Some people say, and I don't like this analogy of having them be the quarterback.
Yeah.
I don't think you can just throw the average Joe out in the quarterback position and expect them to throw touchdowns.
Some people want their doctor to be the quarterback.
They do. They want primary care to be.
Yeah.
And if you design your architect-specialist relationship in a way that facilitates primary care to be that quarterback, fantastic. And that's a huge win. And this is why we're seeing this massive increase in referrals from primary care.
What kind of responses? I mean, do you have any conversations you've had, testimonials from primary care? Do you have a real sense this is impacting their practices?
Oh, 100%. And in fact, we have some data that will be published later this year on this this exact topic. I will say this is, we recently, you see the advent, a lot of retailers are getting into primary care. Whether that's, you see Walgreens announcement, you see CVS's announcement with Oak Street. Just a lot of really cool change that's happening at making primary care more accessible. And I love it. It's fantastic for patients, great experience. We as specialist providers, we need to rise to that level and make sure that we are accessible, affordable, and have that kind of elegant experience that patients are now starting to experience with these really tuned up retail providers.
What I hear you saying is really taking a bite at the accessibility problem of big swaths of healthcare to say there are whole communities whose only access point to healthcare is maybe this one drugstore, this one place where they go, one pharmacist,
That's right.
This access point. And you're saying, like, let's start bringing the best care to those people.
Absolutely, we can scale it, and it's not just a rural problem, by the way.
Yeah.
You even see it in specialty care, even in urban settings.
Yeah.
Same thing. There just aren't enough endocrinologists, there aren't enough nephrologists, and if you can scale them up and do that in a way that is also really beneficial experientially for a patient, healthcare user experience approach, it works.
Last question, what are you most excited about for the next 12 months?
Oh, 100% exactly what we're talking about. I mean, and you can see it in the patients that we work with. Again, we're pediatrics all the way through geriatrics. We had one patient recently, a teenager who was going off to college, an insulin-using type 1, I'm sorry, and didn't have a strategy for what that meant to go live in a dorm, let alone be an athlete. So we work with the Billie Jean King Foundation, and we're working with student tennis athletes, and it's really phenomenal to see the transformation in education that it takes in that particular young person's life. They're now moving into a new environment. I didn't realize that my roommate even need to know that I was dealing with this and living with this condition and what that means.
Yeah. Just to make it clear, the difference is that they're getting coaching. They have a person that they're communicating with. Tell me how sort of the Cecelia Health journey is different than your typical specialty care.
Well, so take your diabetes management,
Yeah.
which involves health coaching, of course,
Sure.
by a CDCES registered dietitian, registered nurse, you name it, with this additional credential. If you need to meet with an endocrinologist, our specialist, our team of clinicians, they're multidisciplinary. No one is usually just one condition. So two, it's multidisciplinary. We also have the clinical protocols that if you need to see an endocrinologist, you can see one of ours in a telemedicine visit as appropriate. In fact, diabetes is very conducive, very, very conducive to telemedicine.
Got it. Awesome. This is exciting, Mark. I appreciate you taking the time with me. It's exciting to see how the company grows, how you impact more people, and this is really cool to see how you're collaborating with primary care doctors to improve the care that they can deliver in their communities, because they are that point of care for so many people. And so to superpower them, it's going to impact a lot of lives. So
yeah, absolutely.
it's great.
Yeah.
Thanks, Mark.
Thank you.